All right, good morning, everyone. Well, good evening to you guys. So it's 6 a.m. over here, so it's the start of my day, but you guys are probably wrapping up. So hi. So Dr. Som did let me know that a lot of you were interested in getting to know a little bit about, the pathway of getting from BDS to the US and how you can practice here. So I thought I'd give you guys kind of a brief outline on, what your options are basically. Before that, I'll just give you guys another brief intro about me. So my name's Shashi. Hi. So, I was in BDS batch 3, which sounds really old now. That's what we were talking about. So I graduated in 2016. After that, during my BDS, I was a little bit confused as to what I would do afterwards because unlike a lot of you, I'm not a Malaysian citizen. So for me, the option of working in the government and then finding a job afterwards was a little bit, tougher because Malaysia doesn't really accept non-citizens into their government practices. So it was actually one of my professors in India, Dr. Arun, who gave me the suggestion, hey, why don't you look into, your options in the US? So he's actually one of the reasons why I, did what I did. So after I graduated, I actually moved back home to Singapore for a year, and I did a little bit of research at the Faculty of Dentistry at NUS, and that was the time that I started applying to dental schools over here. And then, like Dr. Arunima said, I got into UCLA, and then I graduated in 2020, and I've been in private practice ever since. So this is, I'm trying to change my slide. Sorry. Okay. So this is my class, my BDS 3 class. So maybe you guys see some familiar faces, but really good memories with this class. I had a great time in Moneyball, and my teachers, I can't even explain the education that they give you. It's not comparable to anything else. Even till today, sometimes I talk about my teachers and stuff to my friends and classmates and stuff. It's really a great experience. Okay, so let's go into working in the States. So there's a couple of options when you're trying to start working here. Unfortunately, with the actual BDS degree, you're not going to be able to be licensed in America. You're going to have to do something else to be able to practice here. So the most straightforward route, which is what most people do, is to obtain the DDS degree, which is the BDS equivalent in America. So instead of Bachelor of Dental Surgery, they call it Doctor of Dental Surgery. So because you are a dentist in a different country, you're going to be put in an advanced standing program. So what that means is that you're just going to do the last 2 years of dental school, but as an international dentist. I feel like this is a really useful option because when you're moving to a different country, you don't really know how, things are done in that country until you get, some sort of exposure. And so being able to do those last 2 years of dental school with, the rest of the students, it gave us a lot of clinical exposure in terms of how things are done here in the United States. We got to work with professors who have their own, private practices, or they've been working here for, many, many years. And so you get to learn how things are done. Maybe it might be tiny things the technique of a root canal, or how you do your final impression. What we did in, MMMC may be a little bit different from how things are done here. So I think those last 2 years of dental school really helped me, just hone my clinical skills and help me understand how things are done here. They also teach you a little bit about insurances, dental insurances and things like that, which is something that's very, prevalent in the US. And so when you go into working and stuff like that, you already have kind of an idea of all of these things. And then it just makes the process more streamlined. You also get to meet a lot of people, so it helps with networking as well. When you're finding a job and things like that, it becomes a lot, easier. The advantage of this is that you can work anywhere in America with this degree, and even some other countries. So Canada recognizes the degree, Singapore recognizes the US degree too. The other thing is that if you're really interested in volunteer work, like going to other countries and doing, outreach programs, this degree is super beneficial because it's kind of like a world recognized degree. So for example, we went to Jamaica and we did some volunteer work. And of course, the reason why they let us is because, we are dentists from America coming in to help them. And so, it was a lot more easier to get all of that paperwork done. And you also have the option to specialize after. So when you're applying for specialty programs like cross, peds, perio, when you have a BDS degree, things become a lot more easier. Universities will see that, okay, this person has graduated from a university in America and now is trying to pursue like postgrad, basically. So the ease of which you can get into a residency program becomes a lot more smoother, basically. The other option, which some people do, is to apply to a postgrad like diploma, basically. So whether that's GPR, AEGD, or some sort of residency, like again, perio, cross, things like that. The thing with these, especially, is that the number of seats is more limited. So when you're trying to apply to these specialty programs, keep in mind that you're also competing with the rest of the dental students from America. And so they might have like 3 seats open or like 2 seats open. So the odds of getting in are a little more limited. GPR and AEGD, I don't know if you guys have heard of it before. So they're basically GPR is general practice residency and AEGD is advanced education in general dentistry. So what you're doing is a year's worth of more advanced clinical training in general dentistry just to get, more exposure, more experiences in cases that a regular general dentist might have to refer out to a specialist, basically. So with these types of postgrad certifications, if you're not doing the DDS degree and you're just doing this, you may only be limited to practice in some states. So you may not have like a more universal, option to practice. You may only be limited to, for example, the state where you studied in, or just like a handful of states. And like I said, it can be a little more difficult because they are quite frugal with their seating. So they might let in like 3 students a year or like 2 students a year. And if you're a foreign student, it might even be like 1 seat a year. So it's a little bit harder. And at the end of it, you do receive a diploma. So you'll say like, okay, I specialized a year in GPR, or I did a year of AEGD, but it doesn't reflect on, you don't get like a degree or anything from it. So these are the 2 most straightforward routes to get into working in the United States. Some universities do offer you like some smaller programs, like there's a program at UCLA called Advanced Clinical Training. So you can pick between like endo, aesthetic dentistry, restorative dentistry, but you can do these 1-year courses or 2-year courses. But again, those students who did that, once they graduated, they were only eligible to practice in, for example, California, or they could go to like 2 other states or something. So that kind of restricts you to where you're able to practice. But if you feel like, okay, I'm not planning to go anywhere else, like I only want to work in California, then that is a good option for you. Okay, so I'm going to focus on the DDS route because that's what I did, and I feel like it's the most safest option. So what are the things you would need to apply for this? So the first thing that you'll need is all of your transcripts. So you're going to gather your transcripts from year 1 all the way to year 5, and you're going to submit this to an online portal. It's called ECE, and they are basically going to check all of your grades, and they're going to convert it into a US equivalent GPA. So that helps universities understand how much you would have earned or how much you would have graded or scored in school over here. So they may not understand like the way our grading system was, so they kind of equivalent it to their standards, and so they'll be able to see how well you did, like what's your GPA from your cumulative GPA from your dental school, basically. The next thing is TOEFL. So TOEFL is an English language proficiency exam, kind of like IELTS in the UK. So basically, I know we all speak English every day, and for most of us, it's our first language. But because we are coming from a foreign country, they need us to prove our proficiency in English, because that's how you're going to communicate with your patients. A lot of people are coming from countries where English is like their second, third language. And so for them, I think it's a little more difficult to do this test. But for us, it's basically just speaking and writing basic English. So that's fine. The next thing is NBDE. So how MBBS students have to do a USMLE, dental students have to do an NBDE. So it's basically a general dental exam. The subjects range from all your year 1 subjects all the way to year 5 subjects. So they can test you on oral biology, dental anatomy, pharmacology. They can go all the way up to peds, pros, perio. So when you study, there are study materials out there, which you'll have to, gather and start studying for, because their questions can be either very simple or very detailed. And so it used to be a part 1, part 2 exam. Now I believe they've combined it and made just one exam, and it's called INBDE. So you have to pass this to be eligible to apply to dental schools here, basically. So make sure that you take enough time to study for this, just like how MBBS students have to revise before they do their USMLE. You may think, oh, I graduated, I remember everything, but do you really remember the drugs from pharmacology in year 2? So take some time to, study before you do apply for this exam. The next thing that you're going to need is your letters of recommendation. So make sure that you get letters of recommendation from people who know you well or worked closely with you. So you can, of course, reach out to professors at MMMC who you worked with closely, who know you well, can vouch for you. Maybe if you guys are already working, you can, reach out to supervisors who work closely with you as well, or have seen you, as you've grown out in work. And most universities do want a letter from your dean. So Prof. Rashid, it's important to get a letter from him. So basically in these letters of recommendation, try to, communicate to the person that you need the letter from what you want from the letter. So make sure that it's not a very generic letter, not just, oh, he's a good student and that's it. Try to have them give some details about, how they knew you and what kind of student you were, for example, or, what they think your strengths are and things like that, just so it seems like a very, genuine letter of recommendation, because I'm sure they receive a lot of, very streamlined, generic letters. And so I feel when you ask for a letter of recommendation from someone who knows you really well, it reflects. Yeah. The next thing you're going to need to do is a statement of purpose. So this is kind of when you apply to universities, you have to give them kind of an essay about yourself and what you're trying to do by applying to this university. So that's your statement of purpose. It's limited to, I think, 1,500 words or something. It's pretty short. So try to make it show your intent. Why are you trying to apply to the US? What's your goal here? Whether it's, okay, I want to do research in so-and-so topic, or I want to study more about cleft lip, cleft palate, or I want to come here so I can specialize in orthodontics. So try to show some intent to why you're applying to the US, because they get, 2,000, 3,000 applicants a year. And this is the only way to stand out, because everyone's going to have, their GPA, they're going to have passed their TOEFL, they're going to have passed their NBDE. The only ways to stand out that I feel are going to show to the universities are your statement of purpose and your letters of recommendation. So make sure when you write this statement, you do it genuinely. Make sure you do it. I know a lot of people who said they hired someone to write their letter and things like that, but I obviously would not recommend that. Try to write your statement of purpose first, and then I would recommend showing it to people. So show it to your friends, show it to your family, show it to your professors, to see what their feedback would be, to polish it and make it something worth showing to the universities. And the last thing that you'll need to apply is, CE courses and your experience. So for example, if you've been working in the government for 2 years, or you started working in private practice, you can use that to your advantage, because many applicants may not even have any experience. And so you saying, okay, I have like 2 years of dental experience, where I was the, like whatever dental officer at that place, it shows that, okay, this person at least, knows what they're doing, and it might be easier for them when they come in to dental school here. So for me, when I applied, I didn't have any experience. So, that was a little bit of a disadvantage. So I tried to compensate for it by doing, some research and trying to make sure everything else was, worth applying for, basically. So now that you have all these documents, you're going to upload them into something called CAPID. So CAPID is an online platform that the US has created for international dentists, basically to make the process of applying to universities here easier. They just made it an online platform. So you're going to take all of your documents and upload it to this platform, and the universities are going to be able to access this and look at your profile, basically. So they're just going to be able to click on your profile and see, okay, this person has these letters. Okay, I can read her statement of purpose. Oh, she has 2 years of experience. It's all going to be there. You're also going to be able to see application deadlines for each university. Like, they'll be like, okay, our application for 2023 closes in May. So, okay, I need to submit all my documents to them before that date. So this process, at least when you have CAPID, it becomes easier to know, when you need to apply for everything, and it's easier to keep all your documents in one box, basically, and you're not like, it's not chaotic. So for example, let's hypothetically assume that you got in. So you got an interview. So once you apply and a university is interested in you, they'll invite you for an interview. So for the interview process, like I was saying earlier, it's very dependent on the university. So I know people who say their interview is very strenuous, and from day 1 to day 3, they were like very stressed because it's a very technical interview. I can give you my experience at UCLA, but most interviews, they're split into 2 components. So we have a bench test and we have the actual face-to-face interview. So up to now, universities know all your theory. They know you in theory. So what they want to test now is your hand skills. So they make us do a bench test where they test your clinical skills. So for example, they might ask you to do like a class 2 prep or a crown prep. So it sounds easy in theory, but keep in mind that I don't know if it's common in Malaysia now, but over here, most dentists use loupes, the magnification loupes. So all of your preps are going to be scrutinized under like magnification, and everything is measured to the millimeter. So for example, your class 2 prep, they're going to check if the box is 1.5 millimeters. Do you have point whatever clearance? Did you make the bevel? Are there any undercuts? So everything's going to be scrutinized under a magnification glass, basically. And so if your prep isn't to the standard, you get docked down on points, basically. Same thing with your crown prep. It might be like an all ceramic prep on your central incisor. So they'll measure your finish lines. They'll check, okay, what kind of finish line did she do? How much is the clearance? All of that stuff. So I would recommend doing some sort of preparatory course. That's what I did. So even though, of course, I know how to do a class 2 prep, of course, I know how to do a crown prep, learning it in the way that the students here learn it is a little bit different, right? So I did a bench course test just to kind of like, get an idea of how things are done here. What are the steps? So it was like a 5-day course, and the professor went over like, what the ideal dimensions are for the crown prep and the cavity prep, and they just give you an opportunity to practice. So when I went in for my bench test, I was confident. I didn't have any, worries. I knew that I could do it because I had already practiced it so many times. So that's the first component of your interview. So they usually keep the bench test for 1 day, and the next day was my face-to-face interview. So I had like a panel of 3 professors. One was the dean, one was going to be like my department head, and then one was just a professor. And so for me, a lot of my questions were very personal. So they asked me about my family. They asked me, what I'm planning to do once I, get into UCLA, things like that. But I have friends who got really like technical questions. So they got questions like, oh, what's the bacterial components of the mouth in gingivitis and things like that. So it really depends, who the panel is and what they feel like asking you in that moment, right? They also ask you a lot of personality-based questions. So they asked me, for example, how do you think you did on your bench test yesterday? So that's kind of like a trick question, right? Because if I say, oh, I did really well, then I sound too cocky. But if I say I don't think I did well, then I sound underconfident. So that becomes, they're trying to like check what kind of personality you have, like how are you going to be when you join their class. So I basically was like, I tried to keep it in the middle. So I was like, I think I did okay. Like I think my preps were up to the mark, but I think I could have done better if I wasn't so nervous. Like, the nerves I think played a part in my preps. So I think my answer was, in the middle, and I didn't sound too overconfident, but I didn't sound like I had no confidence at all. But I have someone, like one of my friends who was also interviewing, he went too far. So he was like, oh, I did great. Like, I know my preps were great. And he didn't get in, sadly. So I think they really check, what kind of personality you have to see if you'll fit in with their class. Some people got questions like, okay, if you are driving at night, it's late at night, no one else is on the road, and you're driving really fast and the light turns red, are you gonna stop or would you just drive past? So it sounds like some question your friend would ask, and maybe some of you would be like, yeah, I'll pass it. But I mean, keep in mind, they're trying to see what you'll say. Are you gonna be diplomatic? It reveals quite a lot of your personality. And another reason that this face-to-face interview is important is because they just read your statement of purpose. They just read your letters of recommendation. So they're trying to see if that person that was, shown on paper is actually the person that's in front of them. So that's why I'm saying that statement of purpose becomes very important, because they'll ask you questions about it while you're sitting there in front of them. So if you made things up, or if you had someone else write it, it's going to show. Yeah. So that was my interview experience at UCLA. But again, depending on where you get in, your bench test preps may change, your interview questions may change. You might have to study for the interview if they're gonna be more technical questions. Yeah, it depends. So to kind of wrap up, my tips are to make sure you stay organized. So when you're planning who you're applying or where you're applying to, make an Excel sheet, type everything out so you're staying organized. Make sure all your documents are in one spot so when you upload that you have everything you need. Make sure, like I said, make sure your statement of purpose and your letters of recommendation are genuine and from people who really know you and can vouch for you, because I have heard of universities reaching out to the people who write the letters of recommendation to see if they actually were their teachers, and make sure that they actually are good students and things like that. And try to be patient. A lot of people don't get in the first few times they apply. I had classmates who had been applying for like 3 or 4 cycles before they actually got in. And then I know people who got in on their first try. So it really depends, but try not to lose heart when you're applying. If you feel like, oh man, I didn't get in this time, try again. If you really want to, try again, because sooner or later you are going to get in, because you guys are really smart. You guys have great capabilities. So sooner or later universities will see that. And definitely believe in yourself, because when they ask you questions or when they question you, you need to be able to vouch for yourself. Yeah. So that's all I have. Try to stay brief, but if you guys have any questions, I can try to answer them.
Thank you so much, Shashi. It was very informative and very encouraging, and I'm sure everyone would have really taken something, in fact, a lot from the talk. So thank you so much. And over to Sumitra for Q&A.
Okay, thank you, Dr. Arunima. The first question to you, Dr. Shashi, would be, what is the cost for this entire program?
Okay, so again, it depends on the university. So back when I applied, so this was like 2017, 2018, the cost of the 2-year program was about like 120 to 130K. And they split it up into quarters. So every quarter, like every 3 months would be like some amount of payment basically. So it's a little bit of an investment, but they do offer, financial loan options and things like that. So when you get into the program, they have like financial aid offices that you can go speak to and things like that, so that, if you are interested in the program but don't have the funds for it, they can try to work something out with you. Yeah.
Okay, thank you, Doctor. The next question would be, are general dentists overseas allowed to do orthodontic treatment by attending courses?
Okay, so technically, yes, there are dentists who do ortho cases. The only thing is that over here, specializing is a very big thing. So most people who want to specialize in a certain field will do that residency program. So for example, if I love cross, I would go spend those extra 3-4 years doing that postgraduate program so that I can say I'm a prosthodontist. So when you're doing ortho, it's okay to do like general ortho cases. Like I'm an Invisalign provider, so which means I can do Invisalign cases technically. But when it comes to like traditional orthodontics, I would refer to an orthodontist. So I know like old school dentists who still do ortho in their practices as general dentists, but it depends on what state you're practicing in and how comfortable are you doing it, right? So.
Okay, thank you, Doctor. The next question will be, where did you do the preparatory courses, and how to get the information for the bench courses that you attended earlier?
Okay, so are you talking about the one for the interview?
Yeah.
So I did a bench test course in California itself. If you want, I can send you guys the details. It's called Stevenson's Dental Solutions. So the professor, his name's Dr. Stevenson. So he was actually a professor at UCLA. And so he had like a very detailed idea of what the interview was going to be like. And so that was super helpful. When he was preparing us, it's like he knew like the ins and outs of how the test was going to go and stuff like that. And so I already knew that my interview was for UCLA. So when I went to do the bench test, I went specifically to someone who knew, exactly like what I would need to prepare for. So his name's Dr. Stevenson. Yeah.
Okay. And the next question will be, would you recommend the students here to get an experience in Malaysia first before going to US, or which would be better, like to straight away apply to US first?
So if it were me, so if I were you guys, I would probably, of course, finish, my government posting and all of that, because, for example, if you do want to come back to Malaysia, I feel like it would be beneficial for you guys to have some sort of experience in Malaysia before, if you're wanting to come back in the future. And it also helps because you're getting that clinical exposure, so that when you come here and you're practicing, you have some, experience in your bag, and things might be a little more easier that way too. Yeah.
Okay. Thank you, Doctor. And the next question will be, how long did you take to prepare for the NBDE examination, the theory part?
Okay, so theory-wise, I think you guys are going to be okay, because we were taught really well in Manipal. So I don't think it's going to take that long for me. Like I said, it was part 1 and part 2. So I took maybe 1 or 2 months to go over the material. It's kind of like a notes format. So online you can find notes on preparing for the exam. So I spent a couple of months, and I was working too, so it took a little bit longer to study, and then I went and did the exam. So the exam is held only in certain countries. So it's mostly, most common in America. So I had to fly to the US to do the exam. So it took me about 1 to 2 months to study for part 1. And then part 2, I took a little bit longer because it's a lot more clinical based. So it's all of your year 3, year 4, year 5 subjects. So I spent a little more time studying for that. But since they've combined it now, I would probably take 2 to 3 months at least to go over everything properly, because so the number of attempts that you take to pass the exam shows on your record. So if you don't pass the first time, it's going to show attempt number 1 failed. So I would recommend studying properly and passing the first time. So spend your time, everyone's different. If you feel like you need extra time to prepare, take that time, because I'd rather you do it right the first time and pass the first time. Yeah.
Okay. And doctor, is the syllabus in Malaysia, Manipal, Malaysia, and in US the same? Is there anything new that you had to learn for the theory part?
I think for the most part it's similar, but their style of teaching and their style of examining is different. So you know how we studied in detail in our in Manipal, we studied our textbooks, we had notes, we wrote essay answers, things like that. We had a combination of MCQ essays. Over here they're very MCQ heavy. So a lot of their tests and stuff are just MCQs. When the teacher teaches, most students are focused on only the PowerPoint. They don't take the time to study textbooks and stuff like we used to. So I feel like our foundation is a lot more detailed than theirs is. So a lot of times, I'll just give you an example. A lot of there was one time one of the regular students was asking me a question about GIC, but he didn't even know what GIC was, and I'm GIC, come on. So basic stuff, they may not have as much of a detailed education as we did, and so I think our our foundation is really good. Clinically, I think they are a little more, I don't want to say advanced, they are a little more together with technology, I guess. So there's no hand filing in endo, it's only rotary. They use the single cone or vertical condensation technique, which we may not have done in school. You know what I mean? So there's maybe some materials and some techniques might be different. And I think that's why it's beneficial to do those 2 years here, because, professors here will teach you how to do things here, in the way that they would teach you, versus maybe what I learned from Dr. Prashanthi in MMMC might not be what the teacher here does in the US, even though both techniques are great. So I think it's nice to learn, and then you can once you start practicing, it's your decision how you want to practice, right? But it's still nice to learn how they do things here, so that when you're practicing, it just becomes a little more easier. Yeah.
Okay, doctor. And the last question for today will be, do we have to secure a job first before we are eligible to take the exam?
Which exam?
I guess the NBDE or INBDE.
So the NBDE is your foundation exam. So that's what you need to be able to apply to universities here. So that's what you're gonna have to do that before you even get a job, before you even get into a university. So you'll start doing all of that stuff now, basically. So if you're interested in applying, you would start doing all of these things now. So this is all before you get a job. Yeah.
Okay, doctor. I think that's all for the question. I'll pass it back to Dr. Arunima.
Okay.
Thank you, Sumitra. So, if there are no questions at all curiosity and everything is, are we all done with no more questions? Then
they can unmute and ask also if
yes.
Doctor, there's another question. What are the benefits of working in US in comparison to Malaysia?
Okay. So it's hard for me to answer that because I don't have any experience working in Malaysia. But the pay is good. So, I mean, you earn in USD versus, Malaysian ringgit. I feel like it depends. Like I can't really give you a comparison because I don't have one, but maybe the patient pool is different. I'm just more leaning towards like the earnings because I feel like in Asian countries, dentists don't get paid as much as they do in the Western countries. And that's a general like thing that I've noticed. Like some of my like family friends, even working in Singapore, they have moved back to the US at some point because they, whatever they earned in Singapore wasn't the same as what they were earning in the US. Yeah.
Okay, and how about the working hours, doctor?
So again, it depends on what practice you work at. So I work in a 9 to 5 practice, which means a regular 8-hour work day. There are offices that do like 10 a.m. to 6 p.m. I have some friends who work shifts. So she works 8 a.m. to 3 p.m. on some days, and then other days she works 3 p.m. to 8 p.m. So it depends like what kind of practice you're working at, and what you want to do too. So there are people who work like just a few times a week. So they'll do like Monday to Thursday and then Friday to Sunday is off. So depending on what you want to do, like if you have a family or if you feel like you want a longer weekend, you could kind of negotiate depending on the practice. But mine is Monday to Friday, 9 to 5.
Okay, and doctor, how much budget should we prepare once we get the offer from the university before we can get the financial loan approved?
I would say at least keep 2 semesters worth of finances ready, so that you have something to start off with. And then once you get assistance, once you get to speak to the financial aid office and stuff like that, you can see what their options are for semester-wise payments. But at least try to keep like 2 semesters worth of funds, like, $50K maybe. Keep it on hand so that you're not like left with nothing right off the bat. Like you have something for starting off with.
Okay, and doctor, would you recommend us to do the postgraduate in Malaysia first and then go over to US?
So in a way, if you do a postgrad in Malaysia and you come to the US, you'll have that extra experience, but you won't be able to put that on your like office door. You can't say I'm a specialist in blah, 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 because you're not a specialist in America, you're a specialist in Malaysia. So in a way, it might be a little bit frustrating if, for example, you specialize in perio in Malaysia and you come here and you're technically not a periodontist anymore. It might be a little bit more frustrating. So if you are interested in specializing and you're coming here, maybe you want to think about specializing over here, because then you can use that, in your daily practice.
Okay, and doctor, about the format of questions for the NBDE or INBDE exams, is it like multiple choice or essay format or clinical case-based scenario questions?
So it's going to be multiple choice, and it's going to be a mix of like technical questions and clinical based questions. So they can ask you like, I don't know, like something like technical, like what's the drug used for blah, blah, blah. But they can also ask you a clinical question, like a lady was found on the beach and she has like a bruise on this area. What organ could be, damaged or something like that. So you have to know like a mix of the technical and clinical stuff. But the notes online that are available, those are pretty thorough. And so if you read through all of those notes, there's quite a lot of them, but if you do read through all of them, take the time to study that, you should be okay for the exam.
Okay, and doctor, is there any websites for us to go and look for the reference material? Like for example, for the MBBS, they have this Kaplan website where all these materials to prepare the students for the exam is available. So any material in reference for dentistry?
So there's no website. What I would suggest is to go on the CAPID website first and see, kind of explore and see what the application process is like. And then join Facebook groups. So that's what I did, because when I was applying, I was pretty clueless. Like I didn't know where to go for materials and stuff. But on these Facebook groups, it's basically a Facebook group of all the people trying to apply to the US, right? So they ask a lot of questions there. They share study materials there too. So that's what I did. And through those Facebook groups, I got like the study notes and things like that. And it was, some of my questions were answered on those Facebook groups too. So that was a little helpful. But there's not like a specific website where you can like download all the study materials or all of that. You'll have to like maybe look, through Facebook, maybe find someone who has them and like reach out to them, ask them to email it to you and stuff like that.
Okay, Doctor. And Doctor, if you don't mind, why did you choose US, and like what is the difference between US and UK? Is the pathway the same, or is US easier?
So when I was thinking about where I want to go, I was considering Australia, UK, or the US, right? So Australia, I kind of eliminated because to apply for their exam, their like clinical exam, you need to have like a registration in the country you graduated from. And I couldn't register because I'm not Malaysian. So I had to eliminate that. And then I was left with the UK versus the US. UK also is a great option. You still have to do an exam, like a clinical exam and a theory exam to, prove your clinical, skills and stuff like that. So I think in that sense, if you're trying to practice in a different country, the UK is more, has the advantage that you don't have to do extra schooling to start practicing there. You just do the exam and then you're eligible to practice there. The thing is that in the UK, dentists don't get as much of a pay as doctors do. And you know how they have the NHS there? And so a lot of the, money or a lot of the payment that doctors and dentists get is more subsidized because healthcare is free there for their citizens. So in the sense that you'll be able to practice faster, the UK is a good option. I do know people who move to the UK instead of coming to the US. But if you want something, like if you want to learn further or get better with your clinical skills, then I would come here because you get to do the 2 extra years before you start practicing.
Okay, Doctor. And Doctor, if based on what you said, that means if we are Malaysians, then we are able to practice in Australia as well, right?
Since you guys are
Malaysian for the exam.
Yeah. So when you're applying for the exam, it'll ask you like for your registration number and things like that. And so since you guys do register with the government, you do have a registration number. So you are eligible to apply. One of our batch 1 students, Geeta, she is in Australia, right? So she did the exam and so she's practicing there. So,
okay.
Well, there are some questions in the chat too. Was it easy for you to get a job in the private sector as an international dental grad? So since I graduated with the DDS degree, I'm no longer considered an international grad. So I'm now in the same pool as the rest of the dental students, right? So when I was applying on my CV, I get to put that I graduated here. And so chances of someone hiring me are much higher because now I have a degree from here. And then of course your university name gives you that prestige as well. So finding a job honestly isn't that difficult once you graduate with your degree. And then how frequently did you go back to your hometown during your DDS? I used to go back home like twice a year because they give you like a summer break and then a winter break. So I could go home during those breaks. Yeah. And then
Shashi, I have one question for you. Looks like you're having a more harsh interview compared to your DDS interview here. So I just have one question for you with regards to, obviously, you know that I'm not going to ask you dental technical questions. This is with regards to patient expectations. Like, how do you find it different from the Malaysian pool of patients that you handle, their expectations and the way you handle them compared to the patient pool that you're handling now with regards to expectation and others? Over to you.
I think the well, I mean, I was a student when I saw the patients in Malaysia, so I think their expectations were lower. I don't think they had very high expectations of the dental students, right? But now that you're a dentist and they see, okay, this person graduated from so and so, they have pretty high expectations, honestly. And it depends, of course, where your dental clinic is, right? So I work out of Austin, so I'm an hour out of Austin. So I'm more in the suburbs, right? So my patient pool may not be the same as working in Beverly Hills in LA, where everyone thinks, you know, you have to be like a cosmetic dentist. So again, like maybe if I stayed in California, the expectations would be different versus, you know, in a suburb in Texas. Obviously they have some level of expectations, but it may not be compared to my friends who are in LA right now. So, yeah.
Thank you.
Yeah. Someone asked how much I spent in total for all the preparation before the US for TOEFL and NBD. So the applications you have to pay when you're sending applications to universities, I think it's like about $250. When I applied, it was like $250 per application or something like that, like $250. And then when you apply for the NBD exam, you have to pay to apply to the exam. Like when you register for a seat, I think it was like, I mean, things might have changed now, but I think it was like maybe like $500. That's to secure a seat to do the exam. TOEFL you can do in Malaysia too. You don't have to go to the US to do it. Like TOEFL is, they have like English centers all over the world. So I don't think that's a lot because you don't have to like travel for that or anything like that. But for the actual NBD exam, you're going to have to, you know, go to the US and stuff. So that's going to be, you know, a little bit of a money thing. Yeah. But when you're preparing for applying, it's not that much of a financial burden. It's when you actually get in and then you have to figure out like the expenses and like living expenses and then your, you know, tuition expenses. That's when things get a little bit trickier.
Okay, Doctor, I think the rest of the questions have been answered. Are there any more questions?
Someone asked, is it possible to work to sustain yourself while you study for those 2 years? Honestly, I don't think so, because you spend all your time in the dental school. It's hard to have a job as well. So you're gonna spend, like, you know how we spend so much time in the lab doing lab work and all of that, and you know, all of your like prerequisites and all of that have to be done too. So you have to do a lot of clinical skills work in the first few months when you join, and then you start seeing patients. So you have to start, you know, organizing everything. You have to call patients, you have to prepare their patient cases. So you spend a lot of time in the dental school. And then you have to study for your exams too. So it gets a little bit trickier to, you know, work while you're also studying. If you want to, you can. I know people who have like kids who are doing this. So, I mean, if they have the time to look after their kids, maybe you'll have the time to work too. But I spent my time focusing on, you know, the studying part of it. Yeah.
Okay, Doctor, thank you.